This week, Pfizer announced they have a COVID-19 vaccine that is safe and effective for kids ages 5 to 11. Today, we're talking with a local doctor about what that means for Utah kids. Pfizer announced they have tested their shot with more than 2,200 children in a lower dose than their shot for adults. Even with that lower dose, though, they found children developed antibody levels similar to their teenage counterparts. So when can kids expect to actually get a dose? Joining me today to talk about that shot and the approval process, Intermountain Healthcare Medical Director of Preventive Medicine, Dr. Tamara Sheffield. Dr. Sheffield, thanks so much for being here. This is a big topic.
It is, Sarah. Thank you so much for having me.
Can we start with kind of the big picture? So from your work on the ground, how will a shot for children help Utah children?
So what we're really looking at is Utah's children is a big population here, and this is a group that hasn't had access to the vaccine. So it really will help us make a difference in this trajectory of the disease that's passing around our population.
With the Delta variant and kind of with this round of the virus, we're hearing that larger numbers of children are getting this disease. Are you seeing that?
Yes, and what we're finding is that it passes so efficiently. I mean, people several times more, with the original virus, you'd pass it to maybe 1 to 2 people, but with the Delta variant, it's anywhere from 5 to 8 people may catch it from you. So yes, with these kids congregated together at school, it easily passes between them.
That's a large number. So can we talk about the process going forward? So Pfizer now saying its data is good. What's the next step? When could Utah kids actually get a dose?
Yeah, so Pfizer said that by the end of this week, they're going to submit their data to the FDA. And then it will take several weeks for the FDA to comb through that, make sure that they have all the right information and talk to their vaccine advisory group. So they're saying that it's going to be about several weeks with that. Also, the CDC will need to meet, able to give us the clinical information that we need to provide the vaccine. So the estimation is towards the end of October, possibly beginning of November, before this might be available to children.
Okay, so we're talking kind of around Halloween time, possibly, and we've seen this process before with the 3 vaccines currently available. It's got to go through that kind of emergency use approval, right, before it receives full approval?
That is correct, and usually full approval means that they need to have months more experience. So we wouldn't be seeing full approval of this probably until 4 or 5 months later.
Got it. Okay, interesting. Finally, I want to ask you kind of what you're experiencing right now on the ground. In your experience, kind of how is this fall different than last year? We've talked about Delta, which is clearly transmitting at a higher rate.
Yeah, thanks for asking. Here at our Intermountain Healthcare facilities, we are at maximum capacity within our intensive care units, and we've actually stopped doing emergency surgeries in order to be able to divert those beds and that staff toward taking care of our COVID patients. And so and last year we were actually at a low rate of COVID illness and people within the hospital. So now that we're going into kids being in school together with we're going to be now as it gets colder here, we're going to be indoors, and we pass things much more readily at that point. So we're starting at our highest peak levels as we're going into that. So for us, it's critical to have both children, but as many people, all those that can now get the vaccine, to get it immediately in order to prevent more cases coming to our hospitals.
That's just very significant. I want to highlight one thing that you said. You're diverting care from potentially emergency surgeries to be able to help a certain number of people. That's a little crazy.
We're still doing the emergencies, but those things that are urgent for people that really are important for them, with these surgeries, they need them, and we can't do them because we don't have the beds for them.
Dr. Sheffield, we just have a couple of seconds, but I don't want to let you leave without giving people a recommendation where they can go for more information. If they have questions about the vaccine, where do you recommend they go?
The CDC is one of the best sources for information. They can go to cdc.gov and look up anything about any vaccine. And also our state health department has great information online as well.
We're speaking with Intermountain Healthcare Medical Director of Preventive Medicine, Dr. Tamara Sheffield. Thank you so much, Dr. Sheffield. We appreciate your time.
Thanks, Sarah.